Here at McLeod Seacoast, patients and doctors are coming down with the flu, but just because medical staff are sick doesn't mean you're not going to have someone here at your bedside.
Even though they're caregivers, they end up being patients and they need to take care of themselves.
With healthcare providers being surrounded by the flu and working extra to take care of patients, some are bound to get sick.
95 to 98% of our employees do get the flu vaccine. Yeah, you'll still have those that get the flu.
And medical staff don't always call out just because they're sick. Their family gets sick too.
We have seen an increase, of course, not necessarily with staff with the flu, but also with staff with children that they're having to care for.
So how do doctors' offices and hospitals cover for the staff using sick days?
In McLeod Health, there's a group of clinicians called Share the Care who we use as almost like reservists that can come in if we have staff called in.
We have several doctors' cares, so whenever someone does get sick, we're able to pull and borrow and share between staffs.
But sometimes there aren't enough staff to move around. Some doctors' cares offices have had to close early when too many healthcare providers are out. They even had to close one office.
We only had one center in Florence that had to close for a day because, we had a provider sick. Someone was on vacation. Everyone else was working.
As for the cost to the offices and hospitals who have employees out with the flu, the healthcare providers I talk to say they usually break even, and bottom line, caring for patients is more important than the cost of paying overtime.
Taking care of people means sometimes going that extra mile and helping out, and hey, let me do another shift because I know somebody's going to be sick and someone has to take care of them.
I reached out to other local hospitals about their in-house sick numbers, and Conway Medical Center said they haven't had a significant amount of people out with the flu. Live in Little River, Madeline Montgomery, ABC 15 News.
Madeline, thank you. Now, leaders over at Tidelands Healthcare tell us they've had the same number of flu cases in employees as previous years, and when a nurse or doctor does call out sick, they bring in someone who's on the on-call list.